BlueDop's a tool that can be used anywhere you feel like you need to assess the amount of blood flow to a lower extremity. The thing we think is exciting about BlueDop is it gives you actionable information. If you're an emergency room doc and a patient comes in at 2 o'clock in the morning with a painful leg, is that a DVT? Is that a deep vein thrombosis? Is that just arthritis? Or is that actually compromised blood flow to that lower extremity? Which the most critical of all three of those is that compromised blood flow to that lower extremity. Because if it is severe limb-threatening ischemia, you've got a 6-hour window to treat that patient. So BlueDop will allow you to assess that. If you're a podiatrist and you're looking and you have a patient with long-standing diabetes that comes in with an infected toenail, can I remove that toenail? And do I have confidence that that patient has enough blood flow to actually heal that wound? Or do I need to send them on to the vascular surgeon? If I'm a family practice doctor, probably very similar to the podiatrist. If a patient comes in with that infected toenail, can I treat that patient now, or do I need to send them on? Also, as a primary care doctor, you're asked to do well visit checks for your diabetic patients on a yearly basis. And one of those is assessing the blood flow to the lower extremities. This fulfills that requirement. If you're the vascular surgeon and you have an OBL, you're seeing these people in follow-up. This is a very fast and efficient way to follow your revascularization to say if or when I need to start looking at re-intervening. Or even if you do a before and after procedure ABL and vascular reserve. I take a patient, I record their BlueDop readings, I do a lower extremity revascularization, and I record it afterwards. Now I have documentation that I had a positive, significant improvement in flow, not just angiographically, but actually with perfusion and ABPI numbers. BlueDop, we feel, has a universal application in any setting where you need to be able to assess the blood flow or the perfusion to the lower extremity.